Hi, everyone. Welcome to Chapter 7. So in this chapter, we're going to talk all about different types of depressive drugs. So what we mean by that are drugs that reduce sort of the activation within our system or our body. Some of the common ones you might hear of or think of are things like alcohol is actually a type of depressant. Also barbiturates, benzodiazepines. We're going to talk all about these as we go. Again, the idea here is that these drugs sort of suppress some of the activation and things within our body and our nervous system to create sort of this depressive effect on our body. So in this chapter, we're going to cover first and foremost depressants. So we're going to talk about some of the history and types of those, the mechanisms of action, again, some beneficial uses, and again, some causes for concern here. Then we'll also talk about inhalants, some types and dangers of these as well, but won't go quite as in-depth into those. But we'll still discuss some of those factors. All right, so when we're talking about depressants, let's first kind of just break down sort of the history and how these tend to be organized. You can see over on the right that, depiction of them. You can see most of the time we see these kind of classified in really two ways. We throw alcohol in there as well, but really what we see here are what are known as barbiturates, and then benzodiazepines. And so we're going to kind of talk about these throughout the history because they did sort of develop, or at least the more common use of them has sort of been in a linear fashion. So before either of these, or before barbiturates, we had a few types of depressants that were used sort of to help, again, ideally in some kind of clinical medical fashion, that were used here. And we have the first one is chlorohydrate, which really, was used clinically until about 1870 and helped people to basically sleep better was the idea. It was helped to induce sleep and it worked pretty quickly. But when people used it over and over again, it led to some pretty severe gastric irritation, right? So some stomach issues. And so it wasn't something that was really a great solution for some of these problems. We also have paraldehyde. This was, again, clinically used until about 1882, so maybe a little bit longer. This was effective because it had a wider safety margin. Remember, we talked about that. That's sort of that effective dose versus the lethal dose, how far apart those are. So this had a wider safety margin, so it was a little bit safer to use, but it had a really bad taste and odor that actually hung around and came out of the breath of the person. So it was, again, replaced over time because of some of those negative symptoms here. So those were before barbiturates. Then that brings us to barbiturates, basically. So this is a different type of depressant that was used first around 1903 was when it was sort of first introduced. Again, became pretty popular during this early 1900s period. And it generally tended to be separated out or thought of to act under two different general methods, either short-acting, rapid onset drugs, or long-acting and delayed onset medications. So those short-acting, rapid onsets, usually used to induce things like sleep, acting as a sleep aid, and were oftentimes prescribed in high doses. Those long-acting and delayed onset medications were often used to reduce things like anxiety and were prescribed in lower doses. Now, we did have, of course, some specific concerns here about barbiturates. There were pretty frequent overdose deaths, both intentional and accidental, but oftentimes caused by respiratory depression. So basically, your body would stop breathing because it would get too relaxed into that state. There was also pretty high abuse and dependence of a lot of these medications. Oftentimes reinforcing effects of a drug were related to sort of that rapid onset of effects. So because those effects acted so quickly, it reinforced people to do it over and over again. That's a sort of a psychological phenomenon where we have those stronger links in our mind, the faster we see the effect associated with the action of taking the drug. So what this really led to was a need for some safer medications to accomplish some of these similar goals. And what that led to was benzodiazepines. And so these were developed after sort of the barbiturate issues and that sort of time period. And benzodiazepines were first introduced around 1960, right? So we have some examples here. Again, you can see on the chart some of those more common names like Valium, Xanax, things like that. And these affected and had some of the effects similar to barbiturates, but were safer and had less negative side effects. So they still acted to help reduce anxiety, but they produced less drowsiness than barbiturates did. So you could use them more on a day-to-day basis. There was an even larger safety margin, so things like overdose was less of a concern. Physical dependence was more rare, and then overdose really only occurred when combined with other depressants like alcohol or things like that. And again, during the mid to late 70s, some of these like diazepam or Valium actually became some of the highest selling prescription drugs on the market. And so these really sort of took off around that time and became pretty popular to be used in a lot of different ways. However, there was still dependence, right? So they weren't necessarily 100% safe. There was still dependence that could occur. And oftentimes, overdose deaths were more likely when these large doses were taken with other medications. So, when people were dependent on them and they would continue to take them, they might not think about the fact that they were taking them and then also engage in other depressant medications or alcohol and result in overdose deaths. Physical dependence tended to occur usually when the drug was, was leaving the system more rapidly than the body can adapt. So because these drugs got out of the body quickly, the body wasn't able to really adapt to that. And so it needed, more frequent intake of this drug in order to adapt and stay at more baseline levels. So the question really now is, were benzodiazepines safer than barbiturates? And so when we talk about this, again, we don't really now say that that's the case. Really, we say that there aren't many differences. So there are less differences between barbiturates and benzodiazepines as they are within those two categories. So there might be some barbiturates that are safe and some that are dangerous, just like there might be some benzodiazepines that are more safe compared to some other ones. So again, pros and cons to both, and they can be used in different ways, sort of to help with different symptoms. All right, let's talk about the method of action here. So when we're talking about the method of action of these different types of depressants, we look at this in the form of primarily how it affects GABA. So barbiturates affect GABA as basically acting as a separate binding site. So they sort of come into play and can accept GABA and allows it to have more places to bind, thus increasing the effects of GABA. Quick refresher: remember, GABA is one of those components that helps to calm and reduce the effects within the body. So it is a general depressant inside the body and acts as a neurotransmitter that decreases activity. And so if we have more binding sites for GABA, that's more decreased of activation amongst the neurons in this case. Similarly, but working in a slightly different fashion, benzodiazepines tend to bind to the already existing GABA sites that are there, the GABA receptor sites that are there. And so again, both of these act and get a very similar outcome, but they're doing so in different ways. Barbiturates are creating more sites for GABA to bind to. Benzodiazepines are mimicking GABA and binding to the already present receptor sites. So again, two different methods, but very similar outcome. And so what we have here is this creates sort of this GABA receptor complex. And so it's this general idea that there's a lot kind of going on here there's ways to affect this GABA neurotransmitter through mimicking, through adding in multiple receptor sites and things like that. And we're going to talk more about this when we get to the chapter on alcohol next week. And that you're going to see actually acts in multiple ways to affect GABA and other neurotransmitters. All right, there are some beneficial uses of depressants here. We can talk about this for this category as well. Of course, we have anxiolytics. These are basically sedatives that are prescribed to reduce anxiety, right? So we think of a lot of common ones that you might be familiar with, things like Xanax, Valium, some of these other examples here, basically anti-anxiety medications. And they're used to generally lower the overall activation or the overall excitement within this neuro component to, again, reduce the effects of general anxiety. Of course, there are causes of concern, right? It's not all beneficial. Yes, reducing anxiety is fantastic, but we do have some causes for concern with depressants as well. So again, with these anti-anxiety medications, we have examples where we can often see, inappropriate use or inappropriate prescription of these for different types of medical disorders. For example, obsessive compulsive disorder or OCD can often be prescribed these types of medications, which is an inappropriate use and really doesn't help to solve some of those OCD effects. Same thing with specific phobias. So if you have a specific phobia of something and they prescribe you an anti-anxiety medication for that phobia, again, often not going to work and not really an appropriate solution to that problem. They also tend to be overprescribed. So this is something that's more general across the board, but they can be overprescribed, again, for uses that they aren't necessarily designed or effective at treating. We also have some issues with sleeping and some causes for concern with their use as sleeping pills, right? So, of course, they are oftentimes effective, especially early on, at helping people sleep, but can develop sort of dependency and also, baseline with this to where you need more and more to be able to accomplish the same goal. And so again, it does have some issues in this realm as well. Anticonvulsants, so they can be prescribed to treat things like epileptic seizures. But again, some concerns here are that tolerance can make it difficult to find a dose that's effective, right? So you might need to keep increasing that dose to keep the effectiveness at a stable point. And then, of course, abrupt withdrawal is likely to cause seizures. You have to be really careful coming off of these medications so that you don't have actually increased symptoms during that time point. Of course, also things like abuse liability, both psychological dependence, right? So just having that short acting sedatives, things like, some of those depressants that act really quickly on the body is going to create more psychological dependence because you have that association between the action of taking the medication and the resulting effect of it reducing either anxiety or calming you down. And so we have that psychological dependence that can develop really quickly with this type of medication. Then we, of course, have physical dependence, again, similar to things like alcohol withdrawal, where we get sort of those life-threatening issues with a lot of these depressant medications or drugs. So oftentimes they can come with things like tremors or other effects of coming off of them because our body becomes physically dependent upon them to maintain its normal equilibrium or balance. Of course, we have toxicity effects here, both behavioral toxicity, where different types of depressants can cause impaired judgment and coordination, and oftentimes can, again, cause people to put themselves into situations they shouldn't otherwise be in, or just make poor decisions overall. And then, of course, physiological toxicity with depressants, they reduce that respiratory activation, that respiratory rate. And so they can cause issues with breathing, oxygen function. And then, of course, they're even more dangerous when combined with alcohol in this way because they're both acting to do that together. And then finally here, patterns of abuse of depressants. Typically, we see different patterns of abuse for different ages of people. For older adults, it typically tends to be those using prescription drugs, and they've developed a tolerance, and they have to keep increasing their dosage. So maybe they have to go out of their way to find more or go above what they're prescribed by their doctor. And then for younger adults, often it's just people trying to kind of experience those positive benefits of the drug. But again, later on down the road will cause more of those negative side effects. All right, let's quickly talk now about some inhalants. I just kind of go through this quickly to discuss because they do sort of fall into this category. When we talk about inhalants, we think about things like, gaseous anesthetics. These are things like gasoline, glue, paint, lighter fluids, different things that you can inhale, and often used to be called things like nitrous oxide, right? So this is the idea of sort of the laughing gas medicine that we used to have and was used as early as the 1800s here in this case. It's often used as propellants in a lot of these, canister type things. It's still often used by dentists and exists in small portions in things like whipped cream containers and things like that. We also have nitrites. So these are different medications that help to relax the blood vessels in the body. They're often used to treat things like chest pain, and they generally increase the blood flow and briefly can lower blood pressure as well. We also have volatile solvents. These are, again, different types of inhalants that are going to, have some of these effects and similar issues that we've seen with some of the other ones. Some examples are things like paint, glue, things that give off sort of those vaporous fumes that produce some of these same effects. Most of the users of these as a drug tend to be young users, oftentimes even grade school children, because they have access to these things where they don't have access to other more hard, quote, hard drugs that exist out there that have to be obtained in other ways. And so these can be particularly dangerous because of their availability, especially to children. All right, let's talk about some of the dangers of these solvents before we kind of move on to the next chapter. So of course, the dangers here, some of the effects that these can cause. This is not everything, but just some general main things to take away from this. Kidney damage is number one, can affect some of that. Brain damage as well. Also peripheral nerve damage, irritation to the respiratory tract because these are being inhaled. Oftentimes can cause very severe headaches. And then of course, death by suffocation because they're taking up the areas that oxygen would be going into the system, not letting that oxygen get in, and people can actually die through this suffocation. So these are actually sort of, I say, some of the almost like the sleeper drugs where they're fairly dangerous, but we don't always think that they are because they're available to us and something we still encounter on a day-to-day basis. But oftentimes some of the more dangerous ones, again, especially for children and people looking for things that don't have access to other drugs. All right, and that wraps up chapter 7. I hope you guys have a great rest of your week. Next week, we're going to jump into a different type of drug. We're actually going to look at drugs for medications and mental disorders. So a little bit of a unique category there, and talk about how those kind of act within their own realm and how they affect our bodies.